Just 2 exercises and your pelvis will feel like new. In 87% of cases, lower back pain is caused by a problem with just one joint. Finding the cause means solving the problem, so don't miss your chance. Well, hello everyone. This is Dr. Dlin with you, and today I'm going to show you 2 exercises that will help you get rid of pain in the sacroiliac joint, which is located in the lower back. And of course, stay until the end and your lower back will never hurt again. The sacroiliac joint is the largest joint in our body because of the large contact area between the sacrum and the iliac. It is important to understand that the sacroiliac joint is constantly in motion. For example, when we walk, when we stand up, and when we sit down. So constant leg movements, turns, and so on all involve the sacroiliac joint. If this joint becomes blocked, that is, it stops moving due to muscle spasm, then the lower back starts to bear extra stress, and this can lead to the formation of herniated discs and protrusions in that area. This region is under constant pressure, under constant load, and of course, one of the symptoms of a sacroiliac joint problem is not just pain in the lower back on one side, but also pain on the inner side of the knee. Be sure to give a like if you didn't expect to hear about that symptom. What does the lower back have to do with the knee? Let me explain everything to you now. The fact is that very large muscles of the gluteal region are attached to the sacroplantar joint, which participate in stabilizing the knee joint. In other words, the second attachment point of these muscles is actually in the knee area. That's why, for example, when the sacroiliac joint isn't functioning properly, these muscles go into spasm to get overloaded at their attachment points, and the knee, right where the tendons of these muscles attach, begins to hurt. Another one of the most common symptoms is pain in the lower back on one side, either the right or the left, meaning on one side of the spine. But I have good news for you. The condition of the sacroiliac joint can be easily checked, and a doctor can help you do this with special testing. Stop running your life with constant exhausting pain, taking pills, and self-medicating. And now let's talk about the causes of sacroiliac joint injuries. And then we'll move on to the exercises. The most common cause of sacroiliac joint dysfunction is a sedentary lifestyle and sitting for long periods at work. When you're sitting, the muscles on the front of your thighs are tense, while the muscles on the back of your thighs and your glutes, which are antagonists, meaning they work in opposition, aren't engaged at all. They're completely relaxed. This leads to a redistribution of the load, causing your lower back to take over the work. And of course, to compensate for this imbalance, a greater load is placed on the sacroiliac joint, which then has no chance to function normally.
Sergey, what kind of prevention aimed at strengthening the lumbosacral joint?
Right now, we're going to talk about some exercises. The first exercise, lie on your back. Bend one leg at the knee and hip joints and wrap both hands around it above the knee. As you inhale, hold your leg in this position for 5 seconds. Try to push it away from yourself, as if you're pressing it outward while resisting with your hands. Then exhale and pull your knee toward yourself, toward your chest, and hold this position for 5 seconds as well. You should do this exercise on both sides 5 times each. This improves the mobility of the sacroiliac joints and frees up their movement. The second exercise, this one is aimed at relieving spasms in muscles that are improperly loaded. This exercise is done lying on your side. Lie down on your left side. Place your lower arm under your ear, and your upper hand should rest right in the area of the sacroiliac joint. You're basically bracing yourself so your body doesn't tip over. The legs are bent at the knees. Lift your top leg slightly upward, keeping it bent at the knee. Move it forward and try to touch the floor with your knee. After that, bring your leg back, straighten it completely, and move your heel just a little bit behind your pelvis. From this position, lift your leg up as high as you can and hold it there for 10 seconds. Then lower your leg down, but don't set it down completely, and bend your leg again. At this point, place one leg over the other so both legs are bent. This exercise, this cycle of movements that I just explained is actually quite simple, but it might be a bit hard to follow just by listening the first time. You should do it about 5 times on each side. How does this exercise work? It activates the muscles, especially the stabilizers, which tend to spasm and stop working properly when the sacroiliac joint is blocked. This leads to overloading the knee, which then starts to hurt. Overall, this exercise is very helpful for freeing up the sacroiliac joint. And by the way, both of these exercises work together as a single unit, so try to do them together. After all this information, you probably still have some questions for me. Don't hesitate. Ask them in the comments and I'll definitely answer them. Also, I noticed that 80% of people who watch my videos aren't subscribed. Be sure to subscribe to my channel so you don't miss any new videos. With this information, you'll be able to live a great and healthy life. As attentive viewers may have noticed, lower back pain can actually be a sign of problems in completely unexpected places. But we'll talk more about that in other videos. This was Dr. Glenn with you. Bye-bye.